I'm Maura Carley, founder and president of Healthcare Navigation, and I want to talk to you today about Medicare Part B. There are so many things to cover with Medicare Part B, but today we will focus on what Part B covers, how it works, and how it's paid for. That's plenty. Part B enrollment rules are complicated and important to follow, but we'll address those another day. So let's get right into it. Part B of Medicare covers almost all outpatient services and physician services, whether they are inpatient or outpatient. So when you're thinking of laboratory testing or radiology procedures, chemotherapy, those things are covered by Part B. So drugs infused into the body are covered under Part B. Pills and tablets and injectable drugs are covered by Part D. There's always some exceptions to these things, but that's generally how it's structured. So Part B is what you're using all the time when you're on Medicare, when you use medical services, and it's fairly comprehensive coverage. I mean, people are disappointed that Medicare doesn't cover routine dental or routine vision, but on the medical side, the coverage is fairly comprehensive. It was less so when it first started, but over the years, Medicare has added the screening exams we all think of as procedures we should have according to a schedule, like colonoscopy and mammography. You know, there can be times when someone on Medicare gets a bill. An example would be if your physician coded lab work you had at an annual physical that occurred after your welcome to Medicare physical as well care rather than associated with a diagnosis. But if you get a bill when you're on Medicare, it's likely to be small and likely to be caused by something being coded as well care, because Medicare started again as coverage in the 60s existed at the time to cover only illness and injury. But in all, Medicare is comprehensive coverage. And so let's move on to how it works. We're discussing original Medicare today, and Advantage plans we'll discuss another day. You have to be on both A and B to enroll in an Advantage plan, but it's too much to cover in one video. So let's talk about original Medicare. About 96% of doctors in the U.S. have some relationship to Medicare, so that's very good news. If you stay in original Medicare and see them, Medicare is going to cover their services after you meet your modest Part B deductible. The two categories of doctors who have a relationship to Medicare are doctors who accept assignment and doctors who don't accept assignment. Both categories of those doctors submit claims to Medicare, which is a great convenience to you because you're out of the business of submitting claims for the most part when you're on Medicare. That term assignment, however, is important to understand, because if you see doctors who do not accept assignment, that means they submit the claims and Medicare pays the patient. So for those doctors, you have to pay them. Doctors who accept assignment, they submit claims to Medicare and Medicare pays them directly. There's a third category of doctors to be aware of, doctors who opt out of Medicare completely. And those doctors are obligated to let you know that, and you are supposed to sign an agreement that they sign too. The language can vary somewhat, but the gist of it is they're having you sign language which says you understand they don't have a relationship to Medicare, they can't submit claims to Medicare, you shouldn't submit claims to Medicare, and you know they're paying the fees that they establish rather than what Medicare establishes for doctors who have a relationship to Medicare. And you know what? Doctors who opt out of Medicare are very, very compliant with those rules. So let's move on to how Medicare Part B is paid for. Almost everyone on Medicare Part B pays a premium for it. And the government still pays for the majority of Part B through taxpayer dollars. But again, almost everyone on Part B has a premium unless you are a very low income person. And in 2007, Medicare Part B changed so that what you pay is based on your income tax or filing, essentially your income from 2 years prior. And there are 5 brackets now of what people will pay for Part B based on their income. And for high income Americans, that is often the most expensive part of Medicare, although if they're on expensive drugs, that can be more. And another important point is if you're not taking Social Security when you're on Medicare Part B, the government will send you a bill for that. But once you are taking the Social Security that you've earned, then the government is taking that premium payment you owe out of your Social Security money. So the balance is direct deposited into your checking account. But again, once you're taking Social Security, your bills for Medicare Part B should stop. So that's a pretty simple overview of Medicare Part B, but I think long enough for one sitting. So let's end there today. I thank you for watching. Please send us your comments and your suggestions. We look at them all, and we will see you again soon. Take care.